If you are over 60 and your feet start burning the moment you lie down at night, if your toes sting, your soles feel hot, or your legs buzz with pins and needles for no clear reason, I want you to stop and listen carefully. I'm Dr. Alina Serratia, and after years of working with older adults, I can tell you this with complete honesty. One of the biggest mistakes seniors make is assuming burning feet are just part of aging. They are not. Aging can change the body, yes, but burning, tingling, numbness, and nerve pain are signals. And when the body sends signals, I never want you to ignore them. Now, the title of this video is bold, and I know that. Just eat this daily. Stops burning in 48 hours. So let me explain it the responsible way, the way I would explain it to someone sitting across from me in my office. If your burning feet are connected to a vitamin B12 shortfall, then adding one specific B12-rich food daily can begin helping surprisingly fast in some people. Not everyone. Not every case. Not every cause. But I have seen older adults notice a real change in burning, tingling, energy, and steadiness within days of correcting what their body was missing. That is why this matters. And the food I want to talk about today is eggs. Yes, eggs. Simple, affordable, familiar, easy to prepare, and often overlooked. When I speak with seniors who complain of burning feet, weak legs, numb toes, or that crawling electric feeling at night, I always ask questions about blood sugar, circulation, back problems, medications, and nutrition. And again, I see the same pattern. Many of them are under-eating protein. Many are low in B vitamins, especially B12. Many are eating toast, tea, crackers, cereal, or light snacks instead of real nutrient-dense meals. And their nerves are paying the price. Now let me be very clear before we go deeper. Eggs are not a miracle cure. They do not dissolve artery blockage. They do not fix every form of neuropathy. They do not replace medical care if you have diabetes, severe circulation problems, spinal compression, kidney disease, or medication-related nerve issues. But if your nerves are irritated because your body is not getting enough of what it needs to maintain them, then one daily food can become much more powerful than people realize. And eggs are one of the easiest ways to start. Why do I focus on eggs? Because they give older adults a combination that matters: vitamin B12, protein, choline, and other supportive nutrients that the aging body often needs more of, not less. And unlike fancy supplements with flashy labels, eggs are real food. The body recognizes them. Most people can prepare them in minutes. And for many seniors, they are one of the few nutritious foods that still feel manageable, even when appetite is low. Let me tell you what I often hear. A patient says, "Doctor, my feet feel like they are on fire at night." Another says, "The burning starts when I finally sit down." Another says, "I walk fine for a while, but then my feet go numb and my legs feel weak." Some describe it as heat, some as stinging, some as a sock bunched up feeling under the foot, some as ants crawling over the skin. These descriptions are different, but they often point in the same direction: irritated nerves. And here is what many older adults do next. They blame age, or they buy a foot cream, or they soak their feet in cold water, or they keep changing shoes, or they assume it is just bad circulation. Sometimes it is circulation, sometimes it is diabetes, sometimes it is the spine, but very often there is a nutrition piece mixed into the picture, and that piece gets overlooked because it is not dramatic enough to seem important. Yet, I have seen that quiet nutritional weakness push nerve symptoms higher and higher until a person feels miserable every evening. Let me explain what is happening in simple language. Your nerves are like electrical wires. They carry signals from the brain to the feet and back again. But those wires need protection and nourishment. They need a healthy environment to function correctly. Vitamin B12 helps support the coating around nerves and helps the body make healthy red blood cells, which carry oxygen where it needs to go. Without enough B12, the nerves may begin misfiring. When nerves misfire, the feet may burn, tingle, sting, go numb, or feel strangely oversensitive. That is why someone can have burning feet and still be told their circulation looks not too bad. The issue may be nerve function, not just blood flow. After 60, this becomes much more common than people think. I say this all the time. Deficiency in older adults is not always about what you eat. Often, it is about what you absorb. You may be eating enough food on paper, but your stomach may not be pulling nutrients out of that food efficiently anymore. Stomach acid changes with age. Many seniors take acid-reducing medications for years. Many take metformin for diabetes, which can lower B12 over time. Some have digestive disorders. Some simply eat less than they used to. So even if the refrigerator is not empty, the nerves can still be underfed. That is one reason I like using eggs as a daily support food in seniors. They are practical. They bring B12 to the table. They provide protein for muscle repair and strength. They help stabilize meals that would otherwise be too light or too sugary. And when older adults start the day with real nourishment instead of just bread and tea, I often see a domino effect. Energy improves, snacking improves, blood sugar swings calm down, weakness softens, and sometimes, yes, the nighttime burning starts to ease. Now I want to address the 48 hours part. Can some people feel a difference in that time? Yes, I have seen it. Especially when the burning is tied to poor meal quality, low protein intake, unstable blood sugar, or a borderline B12 problem that has not yet become severe. A person eats 2 eggs daily, improves hydration, cuts back on sugary snacks, and within a day or two, they say, "I slept better," or "My feet did not burn as much last night." That can happen, but I do not want you to think this means every case of nerve pain disappears in 2 days. That would not be honest. Nerves heal slowly. The deeper the damage, the longer the repair. So when I say eggs can help fast, I mean they can begin supporting the systems that calm nerve irritation quickly in the right person. That is very different from promising a cure. Now let me tell you how I usually recommend older adults use this idea. I do not tell people to eat eggs once and wait for magic. I ask them to make eggs part of a daily routine, 1 or 2 eggs in the morning, or 1 egg with another protein-rich meal, depending on their doctor's advice and dietary needs. Why morning? Because it anchors the day. If you start with protein and B12 instead of sugar and starch, you often protect your nerves in more than one way. Your blood sugar stays steadier, your hunger stays calmer, your muscles get support, your body has real building material instead of empty calories. That matters because nerve pain after 60 is often made worse by unstable blood sugar, even in people who are not diagnosed diabetics. A very sugary breakfast, then a long gap without food, then caffeine, then a salty processed lunch, then a weak dinner, then dessert at night. I see this pattern constantly. The person says, "I don't eat much," but what they do eat keeps the body inflamed, undernourished, and erratic. Then the nerves complain. So when I recommend eggs, I am not only thinking of B12, I am also thinking of the total meal pattern. Eggs help put structure back where the body has been running on randomness. Let me give you a real-world example. A woman in her late 60s once told me her feet felt like they were burning from the inside every evening. She thought it was poor circulation because her mother had circulation problems. But when we looked closer, her meals were tiny and unbalanced. Toast for breakfast, soup or crackers for lunch, tea in the afternoon, then a small dinner. She was exhausted, unsteady, and dealing with nightly burning. We focused on better protein intake, B12 support, hydration, and reducing long stretches without food. One of the first changes was adding eggs back into her routine. Did eggs alone solve everything? No. But within days, she said her evenings felt calmer, and within weeks, she felt more stable, less tired, and less frightened by the burning. That is the part I want you to understand. Sometimes a simple food works not because it is magical, but because it corrects something foundational. Now, some of you are probably thinking, Doctor, I already eat eggs sometimes, and my feet still burn. Fair question. If that is you, then I would ask several things. How often are you eating them? What does the rest of your diet look like? Are you taking medications that interfere with B12? Have you had your B12 levels checked? Is your blood sugar controlled? Do you also have numbness, balance problems, or weakness? Do you have back pain that runs down the legs? One food can help, but it cannot overcome every other factor if the bigger picture is being ignored. This is why I always tell seniors not to self-diagnose nerve pain too quickly. Burning feet can come from B12 deficiency, diabetes, alcohol use, nerve compression in the spine, thyroid issues, circulation problems, medication side effects, and more. If the burning is severe, worsening, one-sided, or associated with weakness, falls, or skin changes, get evaluated. But if your symptoms are mild to moderate, gradual, and accompanied by low energy, poor appetite, numbness, or a very light diet, then daily B12-rich food deserves attention. Let us talk specifically about why eggs are such a smart food after 60 beyond just the B12. They are easy to chew for many older adults. They are easier to prepare than meat. They pair well with vegetables. They help maintain muscle, and muscle matters more than most people realize when it comes to leg symptoms. Weak muscles reduce movement. Reduced movement worsens circulation. Poor circulation worsens discomfort. Discomfort reduces movement even more. It becomes a cycle. When older adults eat too little protein, their legs often feel older, faster. Eggs are one of the simplest ways to interrupt that. I also want to say something important about fear. Many seniors become afraid of eggs because for years they were told eggs are bad or too high in cholesterol. Nutrition advice has changed over time, and for many older adults, 1 or 2 eggs a day can absolutely fit into a healthy diet. Of course, if your doctor has given you specific instructions because of your personal medical history, follow those. But in general, I do not want seniors skipping a highly useful food out of outdated fear while their bodies struggle with weakness and nerve symptoms. Here is how I like to make this practical. If you wake up and usually have toast, jam, biscuits, cereal, or just tea or coffee, replace that weak breakfast with a stronger one. Try eggs with spinach, eggs with plain yogurt on the side, eggs with avocado, eggs with sautéed vegetables. Even a simple boiled egg with whole grain toast is a stronger foundation than sugar-heavy breakfasts that spike and crash. The goal is not perfection. The goal is giving your nerves what they need more consistently. Now let me tell you what changes I ask people to watch for over the first few days. I ask, are the feet less hot at night? Is the burning intensity lower? Are you sleeping a little better? Are you less shaky when you stand up? Do your legs feel more supported? Is your afternoon fatigue improving? Sometimes the first change is not even the feet. Sometimes the first thing people notice is steadier energy. And then a few days later, they realize the burning is not hitting as hard. That is still progress. Another thing I see often is that seniors who start eating eggs daily begin eating better overall without realizing it. One good choice creates another. A solid breakfast leads to fewer sugary cravings. Fewer sugary cravings lead to less inflammatory snacking. More protein leads to better satiety. Better satiety leads to less overeating late at night. And when blood sugar and meal quality improve, nerve symptoms often calm down. So yes, the egg matters, but the pattern it creates matters too. What if you do not like eggs? Then the deeper principle still stands. Your nerves need B12 and your body needs real food. Other B12-rich foods include fish, dairy, meat, and fortified foods. But eggs remain one of my favorite entry points because they are simple, daily, and realistic. Many older adults can handle eggs, even when their appetite is poor. Many cannot manage a large lunch or dinner, but they can manage an egg. That is why I keep coming back to them. Let me also address the people who say, but my labs were normal. Normal does not always mean optimal, and symptoms matter. I have seen seniors with normal ranges who still looked and felt like people running low on nutritional support. That does not mean you ignore lab work. It means you treat the person, not only the paper. If someone has burning feet, poor balance, fatigue, numbness, and a thin diet, I pay attention to that whole pattern. I do not dismiss them because one line on a report did not wave a red flag loudly enough. Now, if you decide to try this daily egg habit, here is my advice. Keep it boring if you need to. Simple works: boiled eggs, scrambled eggs cooked gently, omelets with vegetables, poached eggs. Just do not bury them in heavily processed, salty foods every day and then expect your feet to love you for it. The goal is nourishment, not turning a helpful food into part of the problem. And while we are talking about what helps, let me tell you what often makes the burning worse. Alcohol, long hours of sitting, going too long without meals, very high sugar snacks, poor hydration, tight shoes, ignoring blood sugar issues, and treating nerve pain only from the outside with creams while never supporting the inside. I am not against foot creams if they comfort you, but dry skin relief is not the same as nerve nourishment. Your nerves live deeper than the skin. I also want you to know that burning feet can carry an emotional burden. I see this all the time. People become afraid of nighttime because that is when symptoms start. They dread taking off their shoes. They sleep poorly. Poor sleep increases pain sensitivity. Increased pain sensitivity makes the next night worse. Then they move less during the day because they are tired. It becomes a loop. Sometimes improving one simple nutritional habit helps break that loop just enough for recovery to begin. Now let me speak directly to the caregivers, sons, daughters, and spouses listening. If an older loved one keeps saying their feet burn, do not brush it off. Do not say, "That happens when you get older." Ask what they are eating. Ask whether they are skipping meals. Ask whether they are taking acid reflux medication or diabetes medication. Ask whether their balance has changed. Ask whether they feel numbness, too. Encourage them to mention it to a doctor. The sooner you pay attention to nerve symptoms, the better the chance of slowing them down. There is one more reason eggs matter here, and it is not discussed enough. They help older adults maintain independence. Why? Because independence depends on strength, steadiness, and energy. When burning feet keep you from sleeping, when weak legs keep you from walking, and when poor nutrition quietly erodes the body, independence starts shrinking. A daily egg may sound small, but small habits done every day shape the body's future. That is how medicine often works in real life. Not with one grand dramatic rescue, but with repeated support that gives the body a chance to stabilize. So if you are over 60 and your feet burn at night, here is the step-by-step approach I would want you to consider. First, do not panic, but do not ignore it. Second, ask whether your daily meals are actually nourishing your nerves. Third, make one B12-rich food a daily non-negotiable, and eggs are one of the easiest choices. Fourth, look at the rest of your habits: blood sugar, hydration, sitting time, footwear, medications, and follow-up care. Fifth, if symptoms are strong, persistent, or getting worse, get checked rather than guessing. I want to repeat something because it matters so much. If your burning is connected to a nutritional gap, the body may respond faster than you think once it finally receives what it has been missing. That is why some people feel relief quickly. Not because the food is magical, but because the body was waiting for support. And please, do not make the mistake of waiting until the burning becomes numbness, and the numbness becomes weakness, and the weakness becomes falls. That progression happens more often than people realize. At first, the feet feel hot, then strange, then less reliable, then balance slips, then walking changes. If you notice symptoms early, you have more room to act. Now, let me close this the same way I would close it with someone looking at me and asking, "Doctor, what should I do tonight?" I would say this: start simple. Tomorrow morning, eat 1 or 2 eggs. Do it again the next day. Pay attention to your feet at night. Notice whether the heat, stinging, or tingling changes. Notice whether your energy improves. Keep track for a week. If there is no change, do not give up on yourself. It simply means you need to look deeper. But if there is improvement, even a little, that tells you your body may have been asking for something very basic all along. I'm Dr. Alina Serratia, and after years of experience with senior health, I have learned that the body often whispers before it screams. Burning feet are a whisper you should not ignore. Sometimes that whisper is saying, move more. Sometimes it is saying, check your blood sugar. Sometimes it is saying, look at your spine. And very often, especially after 60, it is saying, feed your nerves. That is why I keep this advice simple. If your nerve pain after 60 is getting your attention, do not just reach for another cream, another gadget, or another excuse. Start by asking whether your body is missing the basics. And one of the simplest basics you can put on your plate tomorrow morning is this: eggs daily. Because sometimes the road to calmer nerves does not begin in a pharmacy. Sometimes it begins in your kitchen. And sometimes the first real sign that your body is getting what it needs is this: the burning does not hit as hard. The night feels quieter, and your feet finally stop shouting for help.